Saya mute dulu ya, Miss Moderator.
Ya. Hello there, it's Saturday night again, and I hope everyone is staying safe at home. Selamat malam minggu buat semua. I'm Elise Lee here again to welcome you to Community of IKS, and that is Ikatan Komuniti Selamat. We care for you. IKS will try our best to be with you wherever you are, and we will be with you virtually whenever we can. Kami akan sentiasa cuba untuk bersama anda. All right. Building up resilience against mental well-being challenge during MCO caused by COVID-19 is what we're going to share with you tonight. Ya, malam ini kami akan bersama anda berbicara tentang mempertahankan kesejahteraan mental semasa PKP dalam menangani COVID-19. Dan we are also live on FB, and if time permit, we will take in your questions from the audience. Do reach out to us and let us hear you. All right, before I introduce you to our panel speakers for the night, let us have the chairman of the Ikatan Komuniti Selamat, the person who is remarkably close to our heart, Tan Sri Lee Lam Thai, to start off the forum. Tan Sri, building resilience requires a paradigm shift. Do you agree?
Well, I certainly share that sentiment because we have got to ensure that as far as mental health is concerned, we need to constantly monitor, we need to constantly to promote mental health. And of course, we need to go into more innovative approaches to create an interest in mental health, because at the end of the day, mental health is just as important as physical health. And I always say that there is no health without mental health. So in that sense, as I said, I think we certainly require a shift in terms of our approach, a shift in terms of the most effective manner in which we can put across issues concerning mental health and how we can help those people who are affected by mental health to manage their problems.
Yep, that's it.
Yeah. Okay. I'm supposed to speak, isn't it now? Okay.
Yeah.
Yeah. Right. Okay, ini salam sejahtera saya nak ucapkan kepada para peserta lah di online lah pada malam ini, forum online, forum secara maya, dan saya ingin mengucapkan syabas dan tahniah lah kepada Jawatan Kuasa Kerja Kesihatan Kesejahteraan yang dipimpin oleh Dr. Nurai Shikin, dan juga ahli-ahli jawatan kuasa yang lain, supaya kita dapat mengadakan satu forum pada malam ini yang bertujuan untuk menyampaikan maklumat-maklumat yang paling penting kepada para peserta mengenai isu yang begitu hangat diperbincangkan sekarang. Dan di samping itu, pakar-pakar yang terlibat, mereka dapat berkongsilah pandangan mereka dengan para peserta. I certainly would like to congratulate Elise for making time to moderate this very important session. And I would also like to thank Dr. Nurai Shikin binti Ibrahim and Associate Professor Dr. Muhammad Musin bin Ahmad, and also Encik Muhammad Johari Muslim for being able to participate in this just a forum. Now, in my opening address, what I propose to do is that I do not wish to take too much time, but except to say that as far as I am concerned, mental health is gaining more and more significance, or in another way, mental well-being is gaining more and more momentum, is gaining more and more significance in view of the fact that we have many Malaysians out there, who are affected by issues concerning mental well-being. And of course, with the onslaught of COVID-19, the situation has aggravated to the extent that we have been reading in the media about how people are unable to manage the stress, are unable to manage depression to the extent that they are considering this idea of taking away their life, or what I call it, attempting to commit suicide and so on. Now, what actually is mental health all about, or mental well-being? To me, let me just talk about mental health. I mean, from my understanding, I'm not a psychologist, neither am I a psychiatrist, but as someone who has been championing the cause of mental health and mental well-being, let me say here that when someone talks about mental health, it is not just about mental illness. Mental health is something that we all need. Mental well-being is something we all need. It is a feeling of well-being, a feeling of happiness, the ability to cope with life's many challenges, to accept others, and most of all, to have a positive attitude towards oneself. Now, according to Malaysia's National Mental Health Policy, and I quote, mental health is the capacity of the individual, the group, and the environment to interact with one another to promote subjective well-being and optimal functioning. Now, recent scientific and medical research demonstrates that mental health is a foundation for good health, as physical and mental health are actually inseparable. However, in reality, governments, public health practitioners, and citizens alike, they devote little attention and consequently fewer resources to mental health. Meanwhile, the suffering caused by mental illness and mental disorders is actually quite staggering. Patients with mental illness suffer a great deal from the symptoms of the illness and the inability to function normally. And on top of that, they also face discrimination and rejection from the community, which has a detrimental effect on their recovery. So, coming back to the subject, mental well-being, as we all like to put it, it is very important for every individual. Well-being is a positive connotation referring to how people perceive that their lives are going well. Among the factors which are important for mental well-being are as follows. The issue of how people experience their lives via quality relationships, how they assess their positive emotions and resilience, and the realization of their potential and their overall satisfaction with life. Now, this is about how people realize their aspirations, satisfy their needs, and the ability to cope with the environment in order to live a long, a productive, and a fruitful life. Now, of course, in order to achieve this, it requires what is very important, an integration of both mental and physical health. As I said earlier, both are equally important. It is important for everyone to take serious note about mental health and mental well-being. If it is ignored, it can turn to be a serious condition, which will have someone ending up with mental illness ataupun penyakit mental. So detecting mental health or mental illness at a very early stage is very important to ensure the affected person will be given assistance, will be given help, will be given counseling, so that he or she will be able to recover well from the conditions and subsequently would be able to contribute back to the community in a meaningful way. So very important, as I said, what I would really like to convey tonight is this, that at the time when the country is facing a serious COVID public health crisis, and at the same time, we also faced with what I would call mental health just a crisis, because with the number of suicide cases that have been reported, it is indeed something that we cannot ignore. For example, according to the police, just for the 5 months of this year alone, according to the police, 468 cases of suicide. And then in 2020, 631 cases, 2019, 609 cases. I am sure the number is going to increase in the days to come. So I would like to mention here once again that I feel that the very fact that we are having this forum tonight, I think it is very important because we would like our members to be able to understand this issue in greater depth. And at the same time, I think they will also be able to ask whatever questions or seek clarifications on issues concerning mental well-being. But at the end of the day, as I said, we can only expect government to do so much. And I always maintain that we need to have more resources. Resources is very important to deal with the issue. We need more manpower. We need more counselors. We need more psychologists to address this issue. And of course, as I said, with regard to whatever facilities that the government can help to beef up, I think it will certainly be of great help. But of course, finally, let me also say that I think it is not the responsibility of the government alone to deal with this crisis, this mental health crisis. I think it is also the involvement of all the NGOs. And I'm very proud to say that there are many NGOs in Malaysia which are very concerned about mental health, and they are doing their part in their own way to help those who are affected. And last but not least, also the issue of the community. I always believe that the community must always ensure that they must be caring. They must be able to care for one another. They must on the lookout for one another. If, for example, they discover their friends, their relatives have what I call it, abnormal behavior, which is not their normal self, then that itself is already a telltale sign. And that is something which we all ought to be concerned. And the people who are nearest to them, their relatives and so on, must really advise them to seek the help of counselors, to seek medical attention and so on. So anyway, as I said, I don't want to take long of time. I've been given 10 minutes and I really want to comply with this. I think all of you who are here tonight, I think you would like to know more from our experts, Dr. Nurai Shikin, someone who is, I would describe as a lot of expertise in this field. And of course, Dr. Musin himself is a psychiatrist. I'm sure he will be able to share a lot. And of course, to this Johari, thank you for coming, because you also will be able to share with us what are your experiences, how you felt when you were subject to very severe stress, as a victim of COVID-19. So once again, thank you very much. And with this message, I would now like to officially declare open this virtual forum on mental well-being. Over to you, Elise.
Thank you so much, Tan Sri. All right. WHO states that 1 in 4 people has experienced some form of mental illness, and this is quite common. And after COVID-19, the number is even higher. We need to challenge the stigma surrounding mental well-being, educate ourselves, spread more awareness, have more conversations on mental issues, and have zero tolerance towards stigma surrounding it. Okay, now let me introduce our speakers for the night. We have Dr. Nura Shikin Ibrahim. She's a public health physician and sector head of mental health, substance abuse and violence injury prevention, disease control division at Ministry of Health. The next is second Associate Professor Dr. Muhammad Muhsin Ahmad Zahari, an Associate Professor of University of Malaya and a Senior Consultant for Psychiatry at University of Malaya Medical Center. Professor is also a researcher in the field of addiction, custodial mental health, and general psychiatry. And our Encik Muhammad Johari Muslim, an individual who managed to free himself from being a stress victim due to COVID-19. Dan saya ingin mulakan dengan Encik Muhammad Johari. Kita nak dengar perkongsian mengenai pengalaman Encik Muhammad Johari yang hampir menjadi mangsa kepada tekanan akibat dijangkiti COVID-19. Encik Johari, we are so grateful to have you to share this with us.
Yeah, good evening to you.
Yeah, okay, thanks. Apa situasi Encik Johari sebelum, sewaktu dan sekarang ini? Apakah kekuatan Encik Johari menghadapi tekanan ini?
First of all, what I can share today is that selepas I recover, I mean this is a pre and post of COVID-19, kan? Basically the experience, the stress is there, but managing it is a way of how I get to understand more about COVID-19 itself. So it's ultimate. It basically is the inner or the soul strength, the ultimate measure for my mental strength. I think regardless of our religious or beliefs, the positive thing is that I do not give up easily. Because when you talk about COVID, you know, for me, I'm a stage 5. So as a stage 5, the challenge is there. I only focus on
were
what
you on incubator or
I about to, but I managed to go up from there. The only things that when I'm in the hospital, I just listen to what the doctor say, all the doctor instruction. That is how I perceive myself in recovering. So the effort made by the hospital, the doctors, so I just leave it to them based on what their instructions, and that is where I managed to go through.
I understand you were in the hospital for about like 12 days. It's not 14 days, but just 10 or 12 days, something like that.
Yeah, about exactly to be exact, it's about 13 days. 13
Okay.
days. So
how did you get
contacted through because I'm also doing a lot of NGO works by distributing food to the needy. So in between this arrangement, I don't know. I don't know where I get it.
I'm doing that as well. Okay.
So basically, the post and the I managed to go through the thing that is based on my inner
Your inner strength. Yeah.
Yeah.
What do you feel now?
You know about COVID, is the people perception about COVID is nowadays is really worrying me, because why? When they are looking more on towards the statistic that given, whereby when you talk about the numbers of recoveries, chances of people getting through COVID-19, but for a COVID patient, actually, the post-COVID syndrome, that is the most challenges, or that is sometimes quite stressful to us. Because why? The post-COVID syndrome is where it will take about between 2 to 3 months for the patient to recover, to be normal again. But In normal circumstances, yang saya masukkan ialah tanda-tanda dan gejala yang dialami oleh pesakit tu semasa atau selepas COVID akan berlanjutan. So this is a thing that public is not aware. They thought that it's like a normal or ordinary fever. You got the fever, then you manage to go through the fever, then you're okay. But it's not COVID. COVID is not that. So in managing that stress, what I did is that I read more books. I mean, more things, but I always refer to my Sejahtera. Because the CPRC, the KKM, we have all this information that you can go through and read. So from that knowledge or the information that I got, I build up my confidence, things like that. This is where, from that point of thing that I used to manage the stress. Because by anticipating that what is the issue or the problem that might come to us, the challenges that might come to me as a patient. So this is where I build up that is how I overcome the stress. I think that
so you keep yourself positive all the time.
Yeah, it's not easy to keep ourselves positive all the time, but once you have the knowledge, the information, but it must be from the reliable source. It's not from the social media. But for me, I always look at my Sejahtera. So my Sejahtera, you got things to do and things to know. If you go into my Sejahtera, you got things to know and things to do. So I always click these two columns to know that what is happening. So then this is the thing that build up like how I overcome the stress that I managed to go through until now.
Okay, Encik Johari, thank you so much. We will get back to you. Now, we need to acknowledge that mental well-being issues are the new reality that needs to be proactively addressed through the community approach. How can we relate the importance of this problem to one's life? Dr. Mohsin, Dr. Rashikin, we are all so stressed out with all this endless lockdown. Dr. Mohsin, please. Dr. Mohsin, do we have you?
Dr. Mohsin, unmute.
Sorry. Okay. Good evening, everyone. Thank you, Lady Chairperson. I think I'm honored to be here as one of the panel to discuss about mental health. I think I'm very proud because I think Ikatan Komuniti Selamat, this is the first public forum, that being held, and this is about mental health. So mental health is very important regarding to build up the safety of and security of the community. So with regard to the question just now, I'm talking about dealing with the mental health. Of course, is very important because as a workers, as family members, as an individual, as a citizen of Malaysia, I think this is very important to have good quality to ensure we can contribute fruitfully to the country. And I think the more challenging now during this COVID-19 pandemic, and as Tuan Haji Johari mentioned earlier about post-COVID syndrome, and the syndrome itself is what they call a biological symptom. Biological symptom means it is for example, you feel tiredness, you have fever, because during COVID infection you have over-inflammatory response. Your body is inflamed. So the reaction to that, you have symptoms similar like someone have depression, for example. So this is a challenge for like us professionals to ensure following the infection, these people can recover well and can as fast as possible get back to the normal as we wish. However, we can say two components here, and today definitely I will focus more on the psychological recovery. For example, in this case, being I would say intubated or almost intubated stage 5, I think this is very what they call life-threatening, and And some occasions, some people might develop, the fear subsequently, and this fear not overnight. It disappear. It will take probably longer time. In fact, probably more than 1 month. In fact, there's a paper start coming up. I mean, research showed that this is probably can longer up to 6-7 months. That's considered a normal recovery still. But some people, they might be after this, they develop the anxiousness, the like anxiety symptom subsequently. And about your question, how we deal this in the community. Of course, we as a professional, we will evaluate, we try to find whether I would say in it any established treatment, conventional treatment, for example, medication and psychotherapy. But beyond that, when go back to the community, the rest of the community has a important supportive role, I would say, especially when we talk about stigma. I mean, stigma now, like those who are having COVID-19 go back to the community and go back to the workplace, they might have difficulty, adjustment problems, because not everyone will openly receive them back, and the worst still, the one who close to them, the family members. I think this is very important role, because if during the recovery, for example, if they have a good support from the next of kin, the individual that close to them, that will make them able to overcome the psychological challenges, the emotional challenges subsequently. And despite we talked about earlier, post-COVID syndrome, or or any anxiety symptom or psychiatric or mental health problem during the infection itself, inshallah, it can pass through very well if the support system. So the psychosocial support in this situation very important. What I've focused so far is just about those who having illness just now, because we can talk another aspect about public at large. I mean, those who I mean, ordinary people. I mean, I think nowadays the risk about mental health issue can pose to every part or every component of society. You can talk about children, because the thing is changed, their lifestyle changed, the new norm, what we call it, right? So children, adults, workers, elderly, every part component of the society changing. So probably we can discuss this further during this forums, to see we can talk about it.
Okay, Dr. Norshikin, can you continue?
Yeah, can you just call me Anne, Elise? Thank you.
Okay.
Good evening. Salam sejahtera, Tan Sri, Elise. Thank you so much, and to all the panels. Okay, I think on my part, basically, when we are looking at the pandemic as a whole, when we listen to Tuan Haji Johari punya story just now, I think overall, what is happening is that now that if you are looking at it, the cases are not decreasing beyond even 5,000 pun, and the worrying part is that we are going into we are in the midst of uncertainty, not just about life, is also about other things, like work and things like that. So I think let us zoom into the context of first, siapa is affected. For example, if you look at the people who are, kita kalau boleh, one of the stigma, because dalam in this particular mental health condition, most of the time that people are afraid to even tell that you are actually being infected by COVID, that itself is because of the stigma, because people will start blaming you, why do you tak patuh SOP, and basically that actually hinders a person actually from telling, because at that point of time, people need support in terms of, it's not just support in terms of verbal support, in terms, because now di punya era we can't even meet You know, everything has to be done virtually, and it's not easy. For example, if a person cries when a person lose another loved one, you know, to that extent you can't even meet. So basically there's a lot of not just about anxiety, probably sadness and anger, and a lot of Malaysians are actually having all these symptoms regardless of whatever struggles that they are going through. So if you talk about a person who is actually COVID infected, the first thing is actually not even to label them as an ex-COVID patient. Itu one of the things when you talk about to public, kan, kalau some kata bekas pesakit COVID, this is not bekas pesakit COVID, they are just individuals who are affected by COVID. And one of the things that is worrying, because while I am very sure that at that point when Tuan Haji Johari stated his story, you know, at the beginning part, you know, the fear of actually going into another phase because that's stage 5, kan? And I think that support that is needed, because one of the challenges mungkin macam Prof Mohsin is in the hospital side, I'm in the public health side. One of the challenges is actually getting to reach these people that need support. That is one, because sometimes when you are in the hospital, the doctors are also everyday working and they're wearing PPE. So it's not as easy, for example, to actually send a counselor in like before. Dia tak sama in this particular. So we need to do virtual psychosocial support efforts. So basically when we talk about these are patients, not to mention the common symptoms that people are having is actually even now pun anxiety example, and then basically worrying about what is happening to the family when they are in the hospital. Because I remember there was also a particular incident whereby it happens to an elderly. She was admitted to Hospital Sungai Buloh and for treatment, because and the whole of the family, actually the son and the daughter-in-law, they were infected with the grandchild, kan, but they were admitted to MAEPS in Serdang. So what happened was that at the end of the day, somehow or other, because this particular elderly woman couldn't actually contact the because she has no phone, dia tak ada MySejahtera. Macam Tu Haji Johari tadi, dia ada MySejahtera, he still can ni, kan. So maybe a little bit, correct me if I'm wrong, the support system is there, whether between the loved ones, you know, you have your family and things like that. Walaupun jauh, mungkin boleh buat video call. But this particular elderly woman, she was not there. She became sort of numb, that she does not speak to anyone at that point of time, you know. So basically the doctor who took care of her was very macam how do I say, he was like why is this woman not speaking? And at the end of the day, when he actually tried to actually get another, because it was very difficult to get hold of even the family member in MAEPS, because the MAEPS, the ones who are infected, couldn't even call the hospital. They call and they couldn't speak to the patient, you know, to give motivation and things like that. And at the end of the day, I think one of the doctors, you know, was able to actually detect that probably maybe if we can bring someone in, you know, to actually talk through video calls or something like that, maybe things will change. So that's what he did. He actually contacted, tried to get in a hold of another family member that was not infected, and basically to come and actually just sampai dekat to bring that particular, not inside directly, but possibly there's a connection of actually getting to see face to face, in probably pakai cermin di pintu dan sebagainya, using PPE and things like that. And that particular elderly woman suddenly talked, you know, bercakap. So it was so surprising, you know, to that extent. So sometimes there are issues that's going around in their mind that maybe, you know, and what was found, actually, the elderly woman thought that the family was abandoning her, putting her there, you know, because she was very old, and you know, my family is just chucking me here and not saying anything. So basically those are the perceptions. And I think stigma is one of the things that is happening a lot in the public, not just about mental illness or mental health. Even a person, when a person says that you know, they start wondering, and they start sort of, public will start, kat mana dapat COVID, oh my god, you know, like that, you know, it becomes like a, oh my god, you know, macam tu. Jadi one of the things, and the other things, when I think at the beginning when Tan Sri actually talked about the increasing number of cases of suicide that is actually reported in the media, I could say that for the past 3 months, the data that we receive from the police side, of course, it shows that there is an increasing trend as compared to last year. But one of the things that we do not know whether is memang directly affected by COVID itself, but basically these particular people have probably had also income issues, in the sense because sekarang ramai, a lot of people has no income, no work and things like that. They have to pay a lot of things. So what I can say is that social media putting the videos, for example, people uploading the videos
Viral
and
videos.
and viraling it, that is not going to help, because basically we are talking about people who are vulnerable. Most of the time people yang ada those people who actually decided to end their life, initially nobody wants to actually end their life sebenarnya. Tidak semua, maksudnya bukan itu adalah satu perkara yang mereka mahu lakukan. It's something that they want to do, but in split second sometimes, that happens. Why? Because dia dah hilang pertimbangan basically, and the fact that sometimes it's not because that they know that people bukan sebab mereka merasakan tak ada orang yang sayang, ataupun mereka tidak menyayangi nyawa mereka, tetapi sometimes it felt like, being there might be a burden to the people that you love, so they decide to end their life. And it's so sad and it's so heart-wrenching, because when I sort of kalau boleh lah, siapa-siapa yang dapat video tu, kalau boleh I would have macam delete, padam, jangan tular. That is one. So I am so very itulah. I think Azihan is also putting up here, kata my jiran, my sister sangat tua, no handphone, you see. So people do have all those kinds, and I think one of the things is actually surviving through that building up resilience is actually sometimes kadang-kadang pemahaman seseorang itu akan berubah apabila dia melalui proses itu. The perception will change. So basically a lot of people, macam sekarang a lot of anti-vaxxers kan, tetapi bila kita kata now if you don't take the vaccine, you probably cannot go to Tanjung Dawai contohnya, example lah, the things that you like to go, you tak boleh pergi sampai ke, even to go to surau. So people start thinking, should I take vaccine, should I not, and sometimes is about the public. So basically there's a lot of things going on, at least different struggles, I would say different struggles for different people. So kita kena be kind, that's all. Yeah, thanks.
MCMC pernah mengeluarkan nasihat dan peringatan kepada orang ramai supaya tidak viralkan gambar atau video kes bunuh diri di media sosial dan WhatsApp, kerana mereka boleh dikenakan tindakan undang-undang, ya. Ini bagi mengelakkan kejadian copycat yang mempengaruhi mereka yang terjejas dengan kemurungan, di samping menjaga aib keluarga mereka lah. Please do not viral any kind of suicidal or suicide pictures and videos, We appreciate that. Baik, Doktor, kesukaran mental yang sebagaimana yang sering dihadapi dalam masa kita bertarung dengan COVID-19 ini.
Dr. Muhsin.
Dr. Muhsin, please.
So during this pandemic, I would say there's a lot of what they call impact on the mental health. We touched a bit earlier, we're talking about anxiety, for example. Very commonly people presented with this anxiety. Of course, our daily experience as well in the hospital, we noticed the attendees to the clinic. We have clinic, so more people attending lately, especially with regard to stress, and usually related to the family, related to work. Because, for example, work from home is easy to say, but the issue is, for first 2 days, 3 days, probably it's okay to work from home. You feel happy, you don't have to go to work. But after a month, after a week, 2 weeks, you found like, you intertwine your works, your home duties, your student kena buat PDPR pada masa yang sama, guna network yang sama, dan this all can create problem. And I know of experience, you know, even there's a, I mean, somebody get very angry because the lecturer, for example, because I'm also do teaching, they cannot put PowerPoint, for example, because of the network, internet. So there's a many factors here, you know, when we talk, this is one of the factors, work from home, you know, and interactions 24 hours between kids and their parents, you know. Last time there's a break, for example, certain time they go to school, certain time parents at work, you know, then come back, enjoy their time, you know. Now, very challenging with
24
all
hours,
the new norm again, you know. And beside that, anxiety about going out and anxiousness, whether, you know, we have to be cautious, you know. This anxiety also necessary. If you're not anxious, we don't take any precaution, we probably walk freely. I think probably some people, I think I noticed as well in our country, the anxiety is not there, you know. Today is not my day. This is about another relevant to this Ikatan Komuniti Selamat. We're talking about safety culture, you know. We have to take precaution, you know. SOP must strictly be followed, you know, because now with the Delta what they call subtype of this coronavirus, I think is very deadly in nature. So if you don't take cautious, you know, it will make you more worried subsequently. So in terms of mental health, you better take precaution to prevent this. And of course, we're talking another group of people who, for example, have mental illness already. Someone have anxiety disorder, or has what they call it, OCD, obsessive compulsive disorder, with this germ virus around, make them more worried. And this, when you're talking about anxiety, whether it is a normal people or whether our patients, you know, I mean, who are receiving treatment, they have some effect. For example, sleep will be disturbed. Focusing ability to focus on stuff they're supposed to do also probably been disturbed as well. Eating pattern probably change. You know, some people when they stress, they worry, they eat more. So, or some people they can not eating well subsequently. So this can change as well. Of course, mood can change as well. Anxiety become depressed, become irritable, very sensitive person, you know. So all this, we see this pattern of changing. And of course, as I mentioned earlier a bit just now, those who already get infection, this is another issue. We can talk about, I'm dealing with, for example, PFA, psychological first aid in my hospital, you know, for staff and also for patients. And as Dr. Ann mentioned earlier, the methods now, I mean, we have to bear our risk again. So we do virtual consultations or counseling to them. So this is the change. And of course, about anxiety and depression. Beyond that, we can talk about someone who probably, I mean, now, especially elderly dekat kampung semua, anak dah tak balik, raya pun tak tahu raya haji datang ini pun PKPD kan. So the family meeting, you know, like gathering, I mean, our social life is very much important for us to keep well, our well-being. In fact, the definition about social functioning, ability to do the normal socially. But now probably during this time, the definition also probably different, because we cannot do this social. Those who can do socially, something not normal, I have to say. Those who keep not able to restrain themselves from acting socially, safeguard their physical distancing, I think this are normal people, I have to say, during this time. So back to my earlier example, I mean, this elderly, or even in the urban, now we cannot move out from the house. Those who still stay in small, for example, apartment, you know, they can feel isolations. You know, when we talk about isolation, this is normal people. You know, those have to follow the now the PKPD, you know, the or MCO. That's just started in Klang Valley, for example, and we don't know when this the normal life will return. I mean, we don't know about that as well. So this loneliness, one of the factors, that predispose toward depression. I mean, one feeling loneliness is one of the element in the depression as well. And another aspect, for example, is adjustment. So when talking about adjustment, it could be a normal, I would say normal occurrence, because the changing in social interaction, the changing in our lifestyle. We have to wear masks everywhere. We go to shopping last time, probably buying grocery, we can go straight at any time that we like. But now time matters, then queues, last time we can do within 5 minutes, now probably half an hour at least, so this changes lead to the, I would say, adjustment problem, and some people might have, we call it adjustment disorder, become strain in the dealing the daily activities they need to perform, for example. So, and another version important is, again, I cannot underestimate this, post-traumatic stress disorder, those who has been intubated, being end up in ICU. This is very traumatic experience for them. And all these elements that I mentioned, from anxiety, isolation, adjustment, and PTSD, they require interventions, intervention, the lightest intervention. I mean, we need to evaluate them, assess them who actually need more intervention, because not 100% who experience adversity due to COVID will have the impact, but there's probably significant number, percentage of them will be more serious than the rest. And another important point we should emphasize, to complement with Dr. N mentioned earlier, I think I definitely agree. I always mention the first wave is the virus infection, the contagious of the virus infection. The overall second wave is the mental health issues that will arise. Where I already from March last year, I said we give, like, because this pattern happened during economic depression that happened 2-3 times earlier, like in 90s, in 70s, when economic been affected severely. Initially, people laughing, because everyone suffer that. But after a year or something like that, the group of people, for example, there's an increased rate of suicide in Japan. They can post economic depression. So I would say the economic impact of this COVID is similar to that as well. And losing job, not certain about what to eat tonight, and where's the shelter to stay. Now stay at KL. Those who not migrate, kampung people kan, datang dari kampung, datang KL kerja, KL dah tak ada kerja, kena balik kampung, nak siapa nak support mereka financially. So economic issue become a more serious issue these days, and this also contributing to the mental health issue, and subsequently some people will getting more serious and getting mental illness like depressive disorder, anxiety disorder, or schizophrenia, for example. All this can happen to them.
Okay. Dr. N, following Dr. Mohsin, what Dr. Mohsin has just said, I'd like to say that COVID-19 forcing students out of classrooms, forcing entrepreneurs out of businesses, and forcing youth out of jobs. Majority are now working from home, and this is another new norm. Everybody's at home, everything is from home, and here comes the isolation, stress, anxiety, and depression. How do you look at this situation?
Maybe I just, thank you, Elise. Maybe I just want to share with all of you and the viewers out there, when Ministry of Health actually started our battle with COVID-19, that means the whole, bila kita I mean, we are battling with it until now, dah masuk 2 tahun, saya pun tak pernah nak kata dapat cuti pun memang tak ada kan. Basically I just want to share the talian we had our talian sokongan psikososial developed ataupun set up with Mercy and of course you have the talian kasih, kita ada talian-talian yang lain daripada JAKIM. The callers that actually came in just to share as of kalau kita tengok daripada 25th March until 31st December, there was only about 44,061 calls. But if you kira daripada from 1st of January right up until 1st of July, which was 2 days ago, the calls amounted to about 127, 161. So basically an 89% approximately going into 90% is all related to emotional and emotional that needs emotional support. The rest would be things like macam maklumat tentang COVID and things like that lah. But I would say somebody was talking about dah bubuh dah kat situ ada talian basically when you talk about and 40% of that yang memerlukan talian memerlukan sokongan emosi tu are basically those who are calling without income. Jadi itu when Elise actually was talking about home the BDR BDR for women. For people who are working from home, bekerja dari rumah, PDPR untuk anak-anak dia. So of course dia mengundang isolation and dia macam Dr. Musin cakap tadi. But what is more important to me is actually how do you actually want to intervene? Basically dia memang bila COVID selesai, bila kita dah boleh pergi travel and sebagainya, it will actually end, of course. But here I would like to say that bila kita cakap tentang PDPR tadi, a lot of people actually are actually the efforts of how to actually make sure that children goes into class. Jadi one of the things that we actually saw was actually the urban poor. Ini yang ada isu di sini, di mana banyak yang stress sebab tak ada food on the table. Malaysians are generous. Okay, tak apa. Nanti kita jawab apa-apa yang ada yang boleh dijawab. Okay, bila kita cakap tentang PDPR and working from home, tadi Dr. Musin kata the challenge of Prof. Musin was saying the challenge of the parents and things like that. So one of the things that we actually looking, I think we have developed a guideline with KPM antara kementerian to actually improve the system of referral dan satu looking at the program Minda Sihat di sekolah dalam kebiasaan baru. So basically what the counsellors at the school are also doing on top of their job are also looking into the families yang mungkin anak-anak tu ramai tapi tidak cukup gadget. The gadget is not enough, you see, because for example you have 3 children who are having to have PDPR, seorang standard 1 pun kena masuk PDPR juga kan, and then you have a form 3 and then you probably have another one form 5. Now form 3 dia dah tak ada big exam, fine, we are concentrating on form 5, but still you know everybody is actually sharing. At the same time probably the parents will probably, if let's say both the parents are working from home, then it will also be taxing because you are expected, when you are at home, you are expected to do things. Contohnya kat rumah nanti expected sidai kain contohnya, you know, walaupun benda tu sepatutnya tidak berlaku because you're working from home, but you can't actually prevent that from happening. Jadi that particular stress, saya pernah kami mendapat calls yang kita dengar di belakang sana periuk belanga melayang-layang. Kita pernah dengar benda-benda tu. So the stress that people are going through, and then there was also a call regarding a person yang nak minta merentas macam sekarang kan. If let's say you are a husband working in Kuala Lumpur and your wife probably is Johor, sekarang ni dah memang tak boleh merentas contohnya kan. Tetapi if let's say the wife is pregnant contohnya, and then he needs the husband punya care and things like that kan, and the wife is alone, that's actually an issue there because you're isolated. So basically, as I said, Elise, everybody is having their own struggles, tetapi how do you actually help them? Satu is to make sure that probably empower them. For example, like macam what we have in Kementerian Kesihatan, kita ada, because people want to know kat mana nak dapat bantuan. Itu je orang nak tahu. Kadang-kadang people tell us that doctor, if we call, what can the people who are receiving the call say? Boleh kata bersabar. I don't have money, nak bersabar macam mana? And boleh berzikir, so but at least it will, when you call, let's talk to, actually T itu stands for tell someone about your problem, A is ask for help, and L is listen without judgment. A lot of people now, dia judge people. Macam some people kata, oh, saya rasa tak adalah, keluarga tu tak susah. How do you know? You don't even stay with the family. You tak duduk dalam kasut orang tu. You're not in the people's shoes, so you cannot actually judge. So don't listen with judgment. You dah bersangka buruk di situ, and know where to seek help. So basically, as I said, the help is available. Banyak, bukan saja KKM saja yang memberikan talian psikososial atau talian bantuan, tetapi ada a lot of NGOs who are doing good work out there. You just have to access. That means in the internet ke, ataupun ada web di mana-mana. Contohnya macam examples like even somebody was saying Ikatan Komuniti Selamat should reach out. Dia katakan untuk ni, yes, we'll do that step by step. Give us time, insyaAllah. Dan I think one of the things kita kata macam mana you first of all just a little bit, you need to, people out there, you need to be able cakna tentang kesihatan mental. As I said, macam tadi Tuan Haji Johari selalu cakap tadi, dia kata dia dapat sumber maklumat yang sahih. Cakna kesihatan mental, that means you must know what is mental health. When do you reach mental illness? Maksudnya, when do you suspect a person has mental illness? Basically, the common thing is depression, the common one. I'm not saying that ada Prof Mohsin, dia akan jaga bila orang datang kat dia dah merawat, dia dah start merawat. Of course, on top of that, dia bagi psychotherapy and all the other treatment. But basically, how do you identify people among your loved one when you start to have persistent sadness, persistent down, low mood, and feeling hopeless about yourself, and then janganlah tunggu sampai memang betul-betul dah sahih 2 minggu tiap-tiap hari menangis. Masuk 5 hari tu tolonglah, somebody please get help and reach out. The other one adalah feeling loss of interest, kurang seronok atau tidak seronok melakukan aktiviti yang you biasa seronok. For example, like Elise, if for example you love to call your friends, or you love to actually selfie, contohnya, you love to people who love to sing, they don't sing anymore. These are things that when I talk to celebrities, whenever they tell me, then we tell them, please get help, please reach out. So talk to someone that you trust as a start. And then from then on, kita fikirkan macam mana kita nak selesaikan. Because talking to someone itself will not solve the problem. Tetapi at the same time, maybe kita juga boleh practice the road of recovery. Basically is actually, one of it is actually practice good healthy lifestyle. Macam contoh, kadang-kadang kita nak exercise kan susah kan, kita nak dapatkan exercise tu susah. Tetapi kat dalam rumah tu mungkin kita kena cari inovasi. Pasang maybe I don't know, maybe kita try Zumba ke apa-apa kan, kita ada banyak benda-benda, even chicken dance, things that actually can help increase your mood. Walaupun kadang-kadang it is not, I'm not saying that is easy, but burning out is happening also to our healthcare worker. People are crying out, and a lot of things that kalau kita, most of the time kalau kita stress, kita akan marah. Tak ada siapa yang kata stress marah, saya marah. Saya tak stres tapi saya marah je. No, it's not going to happen that way. When you are stressful, you tend to be very angry, you tend to orang kata ada physical punya action and things like that. So basically my point, then you can the other panels can also support and actually add on, is actually start by reaching out, knowing the symptoms, and then knowing when to actually get your loved ones to be actually brought to the healthcare facility. So that's it. I'll stop for now. Thank you.
All right. So how come, on human rights perspective, in a view that health services, especially mental well-being support, must be made available to those in need? For this, I like to hear Tan Sri's comments first before I go to Dr. N and Dr. Mohsin. Tan Sri, please. Tan Sri, do we have you?
Yeah, a short response to your question. Yes, Suhakam has recently made a statement on the subject of COVID-19 pandemic, and it referred to those who are suffering from stress and from all other problems associated with mental health, basically because of issues things concerning loss of income, loss of jobs, and so on and so forth. And of course, it says that they are entitled. They are entitled to advise. They are entitled to psychosocial support and all that. I think that basically is actually is the right of all these people who are affected. So I would say that if these people need help, as Dr. Ian has pointed out, I think it's very important that they must be able to talk to someone. And of course, as I said, there are so many NGOs around, volunteers around, who can help. I'm sure they will be able to be given help. But one very important issue, which I think is related to human rights, is also, just very briefly, I'd like to talk on this section 309 of the Penal Code. Now, Section 309 of the Penal Code says if someone were to attempt this suicide, and if the suicide attempt is not successful, and if he's still alive, well, as I said, he can be arrested, he can be charged in court, and he can be jailed for a maximum of 1 year. Now, as far as 309 is concerned, I think it is already out of date. It is archaic. It is something that should be repealed. And in fact, as far as the Ministry of Health is concerned, and Dr. Ain also know that we have talked about this matter in the mental health, this advisory to council. And now we leave it to the Attorney General chambers to make the necessary amendments to the Act. So as I said, if anyone is found to have committed this suicide, not just because he has so many problems, not necessarily COVID, it can be a financial problem, it can be anything. But all this is arising from the economy, is arising from the public health, this crisis. Then of course, as I said, they are the ones who should be given help. They should not be treated as criminals. They are not criminals. They are those who are very desperate and who need help. And I think it is very important that help must be given to them. It is their basic right. Thank you.
And our country is lacking in psychologists. It was reported that there's only one clinical psychologist to every 980,000 head of population. This is seriously bad, Dr. Ann.
Okay, I think dah masuk policy dah ni. Okay, basically, okay. I think when we talk about clinical psychologist tu ramai bila orang semua tanya Prof Mohsin, maybe Prof Mohsin ni kan, orang selalu tanya kalau saya jawab soalan parlimen, berapa psychiatrist, berapa clinical psychologist. But I think we've got to move away from that because basically when we talk about psychiatrist, kita ada lebih daripada 300 atau 400 psychiatrist over the whole Malaysia. Tak kira sama ada di peringkat whether it is in the government sector, MOH, MOE dan juga maybe Ministry of Defence and also private psychiatrists kan. Tetapi looking at now, we can't afford to wait until nak cukup the nisbah. Yeah, that means ratio nak tunggu one clinical psychologist. In Ministry of Health, we have about only 30, probably 33 ataupun 30 or so clinical psychologists. And then even we please do not forget that we need to do the concept of task shifting. Task shifting is so important. Maksudnya kita empower the public, kita empower, kita turun lagi. Maksudnya looking at the community, people, NGO can be empowered to actually to be able to kesan, people with mental health issues ataupun betul-betul ada mental illness and then suspect and bring them to the facility to get proper treatment. Itu yang important. So kalau kita nak kata clinical psychologist nak ni, so it's the first line. Kalau kita tengok the basement because sorry I don't have any graph here, you need to actually strengthen di peringkat bawah tu. That means the social security, the basic needs, because one must remember that when people have mental health issues, it must start from somewhere. I'm not talking about mental illness saja, and of course banyak faktor yang menyebabkan faktor berisiko, that means the risk factor of developing mental health issues ataupun mental health problems and mental illness. Among them, of course, not to forget the imbalance neurotransmitter in the brain. Kadang-kadang kita tak ada masalah apa-apa pun, because of that you still can develop. So and but of course other social issues, things like macam contohnya tragedi hidup, people yang ada trauma daripada muda, and they don't get out of it, and people who are actually being subjected to domestic violence, abuse and things like that. So bila kita kata that basic punya perkara tu, that means it has to be tackled. Contohnya macam sekarang people whenever we talk about suicidal behavior, we know that the data from police showed that actually among the highest percentage is actually between the productive age group. So we have to look, kenapa productive age group? Probably because of income, probably because of masalah-masalah interpersonal conflict, humiliation, whatsoever. So we need to tackle at the social issues first. Then only slowly up, supaya macam tadi ada saya tengok ni Helmi kata mengikut statistik sekadar kematian bunuh diri akibat tekanan mental mencecah 1000 kes. Apakah tindakan yang sepatutnya dibuat oleh kerajaan? Wow, kerajaan macam-macam. Saya boleh jawab ni, tapi saya rasa saya nak bagi juga peluang sebab masa pun mencemburui kan kepada maybe Dr. Mohsin, Haji Johari later to actually macam Haji Johari dia punya public perspective how can we actually improve, because Ministry of Health has done quite a number of things macam tadi when Tan Sri cakap about decriminalization of suicide. As and when until we decriminalize suicide, then only people will start coming to actually seek help. Kalau tidak, because of that, people will say bila you attempt suicide, you hidup, you akan kena tangkap dan you akan kena charge. Walaupun polis mungkin mengatakan ya tidak banyak, kita kebanyakannya kita tidak charge lah. Tetapi the penal code states that actually kalau boleh kita di peringkat perubatan ataupun KKM, we actually we agree that we support that the idea of decriminalization, because kita tidak mahu bahawa mereka yang ditangkap akibat tindakan tingkah laku membunuh diri itu be taken into custody and akan menjadi dilabelkan sebagai penjenayah satu. But even then a lot of things has been done. Contohnya Ministry of Health has developed a national strategic plan for mental health dan in the national strategic plan it actually outlines the aspect of task shifting, whereby we need to train people. Contohnya macam tadi Prof Mohsin kata train psychological first aid. Psychological first aid, basically when you talk about listen, look and link, kita train the volunteers, kita train the people at the ground, we train the counsellors. Example, we have about more than I think 10,000 counsellors all over Malaysia, tetapi they are scattered. So what we are doing, Kementerian Kesihatan sekarang ni, apa yang tadi kalau Helmi kata apa kerajaan buat, kita dah buat banyak engagement for the past 1 week ni, satu with MCMC. That's why kalau you tengok everyone who's watching this FB, please tune to SPM Selamat Pagi Malaysia at 9 o'clock every morning. You will see one topic on mental health by experts. Okay, then kita juga telah kata engage dengan kementerian-kementerian seperti Kementerian Wanita. We are going to mobilize hopefully the council under Perkama. We are doing the engagement. Kita juga sedang work on the conduct of code of conduct bersama Kementerian Komunikasi Multimedia. Kita ada satu govern body di situ. So all this we are trying to do. On top of that, Ministry of Health, I think we need the support. So concept of task shifting is important, Alice. So I'm going to stop there for a while. So
okay.
Hopefully and we have actually engaged with more than 20 NGOs, dan kerajaan melalui, kalau saya tak boleh share, kita ada kerajaan telah menurunkan 24.6 juta untuk program kesihatan mental, pencegahan kecederaan, keganasan dan juga penyalahgunaan substance yang kita juga turut mengagihkan kepada NGO. So I hope of course we are working with the psychiatrists from university macam Prof Mohsin. So we hope that public like macam mungkin macam Tuan Haji Johari boleh menjadi satu mental health advocate, insya-Allah, for your own maybe for your own fraternity di mana yang you bekerja. So there are a lot of things like maybe we can share later lah, insya-Allah Okay, all right, I'll stop there. Sorry, Elise, for
No
taking
problem.
so long.
Okay, I'll take this question from the audience for Prof. Muhsin. How do we detect asymptomatic mental health which depressed person manage to hide within themselves until a spurs of the moment happens and all hell break loose? Dr. Prof.
Yes.
Muhsin. Yeah.
I know this is very challenging situations, I mean, not many. Usually when we're talking about somebody who depressed, we would be able to see the changes, I mean, the problem is sometimes because of issue of ego, this person not seeking treatment or stigma, like holding HR positions, higher positions, so they're not willing to go to get a record in psychiatry or meeting a psychologist. I mean, because of stigma. I think that's a very important issue. However, we're talking about someone who actually try to hide the depression. I think from my experience, there will be some change on their character, their behavior. So who actually the people who close to them usually can detect these changes, whether usually is a quiet now become more talking, expressing negative point, talking about situation that's not very good for them, talking about what all the negative view of the futures, they're not really outrightly saying poor appetite, not sleeping, I mean, this question quite challenging because I met someone who actually also a psychiatrist committed suicide. So overseas, not in Malaysia, but psychiatrist actually overall figure among the highest among the medical profession committed suicide after anesthetist. So that's the figure worldwide. So this person, for example, this psychiatrist, he was able to hide the symptom of the depression. So I mean, like, open, because as everyone should know, depression or any mental illness is no one being excused. I mentioned about doctors, I mentioned about psychiatrists, even the one close to me. So it can happen to any person. So back to the question, I mean, the changes in someone character is important. Among the beside the way their behavior, the content, what they're talking, the changing on the topic, what they're talking about, that's probably the people who close to them can detect the difference. And of course, talking, I also cannot underestimate that, very important. So you need to talk, and those who listen, there's some quality to so-called therapeutic what they call listening. So first element is active listening. I'm teaching this to many people, including students, medical students. So they are active listening. That means you're not listen with deaf ear. You listen and you process. I'm talking about from the listener point of view. So those who talk, definitely they will talk and distress, but active listening. Secondly, it should be empathy, already mentioned just now. Feel like at that particular person situation, because sometimes we like to refer to ourselves. I can do it. Aku boleh lalu. Kenapa dia tak boleh? So dia yang masalah, tapi kita imagine this problem from our perspective. That's not right. So when you good listener, you have to empathize, feel like what he was experiencing from that perspective. Then thirdly is non-judgmental. We cannot judge people. We cannot say because of your weakness, because of your not enough what they call buat kebaikan, your deed is not good, not good enough, so that's why you are sick like this. So this is form of punishment. So this guy already depressed. You're talking about form of punishment. So this is a spiraling down of the mood further. So this is among the things when we talk to these people. And believe me, I talk to the patient, and sometimes I have to spend like half an hour, 45 minutes with patient to understand them. They say, I feel relief after talking to you. I mean, the skill of listening is very important.
But after they feel relief, what happened next?
Okay, that's my point. That's all my point. Yes, they very much. That's why depression as well, because everyone will go depression. No, I'm talking about not as an illness. The normal response to something. You must be anxious. You must be depressed. For example, someone not calling you. You probably will be anxious or depressed because you expect this person to call. Okay, you're heading for exam tomorrow. You'll be anxious. I mean, this is normal response. So, for limited presentation, respond to something, very clear reaction toward that, and you'll be lasting like half a day or less, and in the afternoon you're able to enjoy about things that you're doing, and tomorrow you'll be okay again. That's considered normal response of depression. Another territory of mood change, like the depressed as well, is more serious, affecting so-called mental health or your well-being also affected. For example, it's happened for a few days, until you require to take medical leave, medical certificate. So that's considered something already venture toward the mental health issue. Another end is what we call disorders. So disorders, they already have other symptoms as well. For example, we're talking about feeling hopelessness and feeling life is meaningless. They feel like they are hitting a wall. They cannot resolve the problems. As mentioned just now, can see about. I mean, one of the in the comment that I see about believing, if I die, you can claim insurance and the family get benefit. Now I'm facing financial problem. Yeah, this is another way, but of course, again, that probably not the best solution, because those who, if you end your life, those who left behind, perhaps they will face more problems, and money, not everything can buy happiness to anyone after all. So
Thank you,
that's
Prof.
my comment.
Thank you, Prof. I'd like to go back to Encik Johari. Encik Johari, he lost like about 12 kilos, 12 kilograms within 12 days. Is that so?
Within yes.
Yeah. How are you rebuilding yourself back now?
Basically, how I build the resilience, actually, for me, is to take good care for myself. So no one can take care of me as well as myself. So I should be caring about emotion and personal needs. The physical health should be emphasized. And then you talk about the second one. I learned to see the potential in me. So and to be positive. I mean, identify own strength. So by doing in building up I'm not concerned about really I'm not really stressed on losing the 12 kilo. It like blessing in disguise also. So it keep me fit actually, because from 76 kilo now I'm about 68. So basically I look at more positive than the negative part. So this is the reason how I manage myself, because by then I can avoid stress. See, because by accepting the fact that it benefit me in terms of health, no doubt losing 12 kilo in maybe in 13 days, but in terms of health, actually it's good for me. So, but the challenge that is it's not easy to be that positive when people start to when you start to meeting people, then they ask you, hey, you look very skinny now, you are thin. Then some even label that, oh, this is the gain COVID, say like Dr. M mentioned just now. So these people out there sometimes make we more stress as compared to, even that we try to be not that stressful, but sometimes because you are in connection with with the public. No doubt it's MCO, but sometimes you go to buy to country shop, things like that. You meet your neighbors. So these are statement that bring you down. But for me, I'll always look it more on the positive side. That losing 10 kilo is not something that really bad for me, but it's good for my health. So this is how at least that for me, that is how I build up my positive thing to myself as compared to being like down or whatever feelings that you have. Because losing 10 kilo is for me is positive.
It's a blessing in disguise.
Yeah, blessing in disguise.
Yeah. Okay.
Hari, interesting, 12 kilograms, it could be significant. That's a lot within probably 2 weeks or 3 weeks.
Yeah.
No, because doctor, the thing is that I don't know, so maybe because of the seriousness of my condition, because I was put on fasting.
Yeah.
So maybe they are preparing, maybe I don't know, because this is all the protocols that the hospital have, but maybe they are planning to put me into incubator. So that's why I was fasting. For the first 7 days I was fasting. There is no food, nothing. So I was on fasting mode.
Okay, after you lost that 12 kgs, how do you feel about that 12 kg gone? Were you weak? Were you or are you still weak?
No, because when you talk about COVID patient, like myself, I'm more on bedridden. I want to put tube, things like that. The urinate using tube, things like that. So mostly it's bedridden. So for the 14 days you are on bed. So there's not much movement. So that make your muscle everything gone. So you're like your leg, your thigh is like there is no muscle at all. So it's very flabby, things like that. So after I was discharged on the 27th of May, from the 27th onward, this is why I start to walk, things like that, to build up that muscle. Because before that, you can't even stand long. I can't even stand long because of too many days on the bed. This is where I believe is myself to take care of myself.
Okay.
It's me that I have to take care of myself.
Encik Johari, when did you start to feel stress? When do you start to feel down?
The feeling of stress is when the first because in a family of 5, myself, my wife, and 2 children confirmed COVID-19.
Oh, the whole family.
Except for my daughter, the whole family. So by then because of they have to scatter. We have to scatter in terms of the swapping, to do the testing, to do the COVID testing. So myself, I go to a normal BP lab or normal private firm to check my COVID. So once I was detected as positive, then I reported to KKM, and this is where the whole family start to go for swab tests.
Were there any symptoms at all before that?
For me, I don't have short breath. I only have like fever, high fever. Every 6 hours after I take Panadol or whatever, paracetamol, then the temperature will go down. But 4 to 5 hours later, it will go up until 39 to 40. So after because knowing like I mentioned earlier, is to know about the COVID itself. So that is among the symptoms that I noticed. The temperature changing within the 4 to 5 hours is very grievous, very fast. But once I took paracetamol, then it reduced. Then after 2-3 hours, the temperature go back to 39, 40. So this is symptom that I believe I got COVID-19.
Okay. Okay. Thank you. Cik John. I would like to take another questions from the audience for Dr. Anne probably or Prof. Elderly have been facing some anxiety or panic attack when receiving fake news or inadequate information about COVID-19. It took more time to explain and get them to calm down and to understand the whole real situation. How can we address this?
Okay. I think maybe boleh saya jawab ke Prof Musin atau Prof Musin nak jawab dulu? Prof Musin ke mana?
Silakan Dr. Anne, silakan.
Okay, alright. So I think in the early part tu, if you can remember, every day
silakan
setiap,
Dr. Anne.
okay, thank you.
Okay.
Okay, thank you. Thank you. In the early part, I think even starting from last year, if you all can remember, when actually bila Tan Sri Director General Tan Sri Nur Hisham, Dr. Nur Hisham announced every day kan kita ada, we had a press conference every day, almost every day, and it was like in the press statement, press conference, every day he will be talking about elak 3S, amal 3W, things like that. And at one point of time, there was this announcement of the number of deaths were increasing, and of course the number of deaths was announced with comorbid. Maksudnya mereka yang meninggal tu kebanyakannya has hypertension ataupun diabetes, basically diabetes and also heart problem and things like that. Basically comorbid lah, ada penyakit kronik ke dan sebagainya. So it was announced together. That means those people who are at risk of not to say at risk, if they are infected, the chances of landing up in ICU is higher and the chances of death. So masa when we announced, I think that was the anxiety and the fear of the elderly of actually being infected, and also it develops the anxiety lebih. Jadi we developed for KKM, what we tried to do was actually to develop more infographic using that, and itu yang keluar ada video-video and then ada infographic tentang tok ayah, you know, benda-benda macam tu. So di mana when you talk to the elderly and you tell them, you know, yes, elderly can get infected, dia kata, and of course that's why we try to actually convince them that the most importantly is actually to stay at home, and also the family members, especially itu yang kita halangkan masa berlakunya orang pergi kunjung mengunjung masa hari raya, you know, the family members, the young ones, you know, get the elderly to be infected. So the anxiety is there, Elise, definitely for elderlies. But what I am more concerned now, if right now there are also elderlies who do not probably want to have vaccines, and this sometimes I witness, you know, especially when we have conversations kadang-kadang whereby even the children, I sort of please for children who have elderly, do not tell these elderlies, you know, okay, ma, ayah, because you dah berumur, you dah the literal word and the very crude word is you dah tua, you know, tak payahlah vaksin, you know, macam tu, you know, on that part. So I think that kind of message must not be actually sort of transpired. And the other one adalah for these elderlies, we need to give them information. That means the family members, the children needs to play a role on how to give accurate information to convince the parents, to convince this elderly to probably macam sekarang is more of vaccination and staying at home so that they won't get infected. And probably for people who are coming to visit, macam now dah PKPD, kita dah PKP dan sebagainya. So basically for those coming to visit, to practice very, very strict SOP. Walaupun kadang-kadang kita teringin, macam contohnya when I visited my uncles and aunties in the northern, walaupun kita jumpa masa tu we were allowed to cross border kan, masa tu after Hari Raya kan, I remember last year vaguely, but we did not hug each other. you know, we had proper distancing, you know, and basically those are the things that I think we need to convince them, because kita budaya kat Malaysia ni, kita masih kita masih hugging tu actually kan Tan Sri, mental health good, hugging, you know, orang kata cuddling each other, and you know, tepuk, padding on the back, but that cannot be done anymore now in the new norms. So I think we need to help convince the family members, especially to convince the elderly with a proper education. And in KKM, we are trying to do that with a lot of infographics, yeah, that we passes through social media, inshallah. So hopefully, okay, I will stop then.
Prof, you may add.
Yeah, I mean, we can see even in the clinical setting for, I will cross, you know, a little bit, the anxiety disorder, for example, is more prevalent among aging group. So generalized anxiety disorder, I mean, in the normal circumstances, so we can see, for example, worry about their children, worry about their, what they call livelihood, they worry about, you know, anything they can think of. So when there is a COVID pandemic now, I think this will be make them also the predisposing group in terms of becoming more anxious. And that's one of the explanation when it's related to the load, the loads of news, you know, especially fake informations. This is make more difficult, because I think perhaps the younger people have probably more literate in using the information technology compared to elderly. Whatever come to their WhatsApp group, you know, that they join, you know, they probably will trigger this anxiety. Then of course they will think about, now will I meet my children again? You know, where's my chuchu? You know, all this, you know, as I mentioned a bit earlier. So these life circumstances will make them more predisposed to anxiety compared to younger group, perhaps, you know. But probably the younger group, they're talking about economic issue where they are losing job, or their student, how they're going to follow their study and so on. But for elderly, they worry about, where I going, if anything happened to me, you know, you can see, you know, like you go for burial, you know, when during SOP, you know, it's very strict, you know. So this all I heard. Some elderly mentioned, what happened to me if I die during this time, you know. I have one patient ask me that kind of question. So it's very difficult. But I think I'm strictly what they call agree when talking about 3C. You know, whoever, I'm from the day one, we have this COVID, you know, the close, confined, and crowded. Avoid this. So if you have one factor, higher risk. I mean lower risk. If you have two, higher. Then if you have all three, it put you at the in the dangerous situation. So these days, perhaps I'm not saying what they call to exaggerate the situations, but actually now it's sporadic. Sporadic means it can happen in the community. You know, it's not necessarily via cluster. Sometimes we cannot detect through the cluster. It can happen anywhere. I mean, Dr. N is a public health specialist, would know this point better than me.
Yeah.
So the issue is, everywhere you have to be precaution now, regardless where you are.
Okay.
Okay.
Now let's go back to children. Prof earlier mentioned about the children. Now, children have been impacted by the pandemic, and their mental and emotional needs must be a priority in the country's recovery plan. Your take?
I think it is very important for this special group, I have to say, because children is not like adults, you know. They are actually in the growing age, you know. Actually, they need to learn the social element very much, you know. They are growing up in the right social element. So social elements talking about, you know, able to play with their friend in the neighborhood, go to school, play with their friends, and they learn talking to people, interact with people, do it this way. I mean, this is a normal way. But now, very unfortunate, this cannot happen effectively at this moment. They are confined to the home. So I think now, perhaps in the what they call family environment, family household, as Dr. Ann mentioned earlier, I like that. At home, you have a good quality time with your kids, you know, the parents. For example, what Zumba, you mentioned for Zumba, or something that can do together, playing game together. I know the internet or gaming also probably not good. I mean, talking about internet gaming, but in this case, you know, you can play with PlayStation with your parents. However, under safeguard of the parents, I have to say, because during at the time you're already in front of the computer for PDPR, now you still in front of the computer for the game. That's not a good advice, basically, after all. But anyway, my point here to emphasize on the quality time together with your kids. Beyond that, perhaps very important, this is the time, because all the time parents at home with the kids, the role model is very important here, meaning that parents have to show good interactions, cannot take for granted the presence of their children at most of the time at home, where parents probably very hostile toward children, or relationship between parents itself not healthy as well, so can affect the children. So they have to be sensitive. The home environment should be conducive and very thriving, what they call psychologically thriving for the children in the positive way, so they can build up their emotion at home in the good way as well. Okay, that's my take.
Maybe Elise, can I add a little bit? Not to add. Yeah, I think one of the things. There are two things I just want to add. When we talk about children, yeah, especially at home, I think we also need to have an effective communication between the parents and the children. Kadang-kadang most of parents always think that children as early as probably even 5 years old or 4 years old, you know, you don't understand. But of course, I think they need to be actually explained about what is happening, the changes, COVID, you know, and things like that. And of course, sometimes when children they need to play, they are mental health needs of the children, kan? Tetapi I always believe that if you're at home, you need to communicate on a daily basis. That means to find out what they are doing and how do they feel about this current situation. Kadang-kadang the parents always is like about, you know, I want you to do this, I want you to do that, you cannot do this, you cannot do that. But you don't actually ask the children, how are you feeling? How are you coping with your PDPR example? You know, are you experiencing jangan macam contohnya bila budak-budak tu, especially the teenage lah, I can say, not just children. When you talk about children and adolescent, those are probably between 10, you know, until about probably 18. You know, even my cat is also stressed for not seeing the tuan. You know, the tuan is inside the room. My daughters, you know, because she's also having classes. And then apparently, I think you need to talk to the children. Satu, yang mana young ones. And I think one of the things about parenting ni, you need to actually sit down and discuss the responsibility and roles of everyone at home. Contohnya macam katakan buang sampah, you know, because everybody's at home now. So macam mana kita nak divide that responsibility and to say that, you know, macam I saw this one, some people are very stressful because of work from home, PDPR, mothers on the same platform need to cook. Yes, stress and take care of the kids. It's not easy because now the Taska is not opening, the childcare is not opening, school is not opening. So we need to sit down and come to a consensus, especially talking with the children, you know, okay, look here, you know, this may not probably, it is going to be a marathon. It may not, we do not know when it's going to end, but whether we like it or not, we'll have to stay under the same roof. So we need to find some form of agreement so that even we disagree with certain things, we learn to agree to disagree. So I think that's one. The other one, how could we ensure safety of children who are not vaccinated, are not infected after we have achieved herd immunization? That is going to be a tough one, CY Tan. But apparently, kalau kita tahu, children, they have a higher immunity. they have stronger immunity. So most of the time, that's why when we see children, most of the time, if they are infected with COVID, they do not show symptoms. And a lot of things that when we talk about herd immunity, inshallah, whenever, for example, I take for example in my family, 2 of my children are still not vaccinated. The other one memang belum probably layak, because one is 15 years old, the other one is 21. She's still not vaccinated. And of course, we as the other ones who are vaccinated are the ones that's covering for them. So I hope I can answer CY Tan for that. There was one more case I just want to share. When you talk about elderly, tadi bila kita kata elderly, they have anxiety. I managed to actually come across with a patient when I was working in the COVID assessment center last few weeks. This particular uncle, he was above 70. He came alone because he was diagnosed to have COVID positive, and his saturation oxygen was 88. Only at 88, less than 90%. He didn't want to be admitted. He refused to be admitted. It's so difficult because he kept on saying that this is what God has given him and things like that. So it was very difficult to, in fact, when we call our family medicine specialist, and we have counselors there, I was there, but he didn't want to be admitted until we actually convinced him that we brought in a police to actually try to convince him in a softer way, so that police talk to him. Police had to wear PPE. We also had to give some online on-site sort of a little bit of training, a little bit to the police on how to pelan-pelan cakap, pujuk and pujuk. Some or other. At the end of the day, when he was admitted, we managed to get him. They promised, okay, only bawa to hospital Sungai Buloh. Jadi apabila dah keluar, that means he recovered and he was about to be discharged. He sort of got up. He was actually suffering from delirium sebenarnya. So I think one of the things that kadang-kadang bila when elderlies are behaving in a very different way, ataupun something that we probably kita rasa maybe something is not right somewhere, please make sure that we refer accordingly, because they may need psychological assessment. Okay, all right, that's it. I'm going to stop there. Thank you.
Okay, looking at the country's recovery plan on the children who have been impacted by the pandemic, I'd like to hear from Tan Sri. Tan Sri, please.
No, I'm not giving any comment, but I wanted to take up one point raised by Dr. Ain. You see, early on, she spoke about the word stigma. And I think she is spot on, because this is what I came across just a couple of days ago. A friend of mine, he called me over the phone, and he told me that he has a number of friends, who happen to be COVID positive, and eventually they all were brought to the hospital. In fact, 4 of them ended up in Sungai Buloh. They came out, after spending some weeks there, and they were discharged, from Sungai Buloh. But this person who called me, some or other, he has this question to ask me. He said, although they are my close friends, but the very fact that they had COVID did before, I don't think I want to mix up with them again, because he always had the fear that a COVID patient, who although has recovered, but eventually he said, well, when they meet, it will pass on, it will infect, those who are not having COVID. So I think this is an issue of destigmatization. And I really like to ask Dr. Ain, what the efforts are being made by the ministry to really bring about this destigmatization. Just like a drug addict, a drug addict who had gone to this Pusat Serenity last time, they recovered. But when they came out also, their friends still regard them as addict, So he had that kind of stigma attached to him. So the same way with regard to COVID. So I think, in fact, Johari also has raised that issue, which I think is very important. How people like him can be destigmatized. Thank you.
Okay. So I have to answer to Tan Sri. Okay, Tan Sri, basically I think the efforts that ministry, I mean I'm sitting there kan, efforts that ministry is doing basically to destigmatize mental health and probably people with mental illness has also needs the efforts of other ministries too. For example, like I think we need to actually what ministry has done, of course kita, that's why macam sekarang ni we are encouraging more people to come forward to talk about their problem, to get help, and to tell that it's okay if you are actually suffering from depression, or actually if you are actually having mental illness, you know. But then the Ministry of Health efforts needs to be also coupled by other support from other ministries. For example, like the policy, in fact, the mental health policy atau creating a mental health policy at the workplace contohnya, because once a person is actually being diagnosed to have mental illness and receiving receiving treatment kan, these particular people probably being stigmatized in the workforce. Contohnya the work are being taken from them, and then they are being sort of perceived not fit to work, and then those are the things, Tan Sri. So I think on the Ministry of Health side, the most sekarang ni we can do is actually to work with other ministries to actually convince other ministries that you need to actually look into the mental health status of the workers, and not to stigmatize them if they need help, especially ataupun allow them to buy time to actually get help, you know, because of their problems. So one of the things that I have said, contohnya macam dekat tempat kami, dekat Kementerian Kesihatan, I have been given the authority, insyaAllah, for ibu pejabat, if a person is actually suffering from severe stress, they can actually be given MC through a klinik kesihatan, tetapi it extended to itu, tapi itu adalah dalaman buat masa ini, Tan Sri. Jadi sebagai contohnya, jadi mungkin adakah, for example, if a person has cirit beret contohnya, ataupun you know, they have a fall, or they, whatsoever reason, physical punya illness, demam contohnya, ataupun even running nose yang bad ke apa, you can go and see a doctor to have, like for example, and you can get off, you get an MC for 2 days. But a person who probably at the verge of developing depression symptoms, that means you have actually been actually going through those particular symptoms, the symptoms of depression, the early warning signs, probably for the next 1 week you dah go through, but you are not taken in the sense that you can actually take leave ataupun you can take MC for that particular reason. So basically itu adalah antara usaha-usaha yang I think needs to strengthen in terms of taking care of the mental health at the workplace. Because that is one of the things, Tan Sri, we have to push for the mental health policy dekat workplace. And then mungkin some efforts, but we are doing that. Maksudnya we are actually advocating mental health messages to destigmatize. So more and more people are actually coming up to do. Macam contoh, I think we need to have more forums like this. Although kita kata maybe a lot of the public out there mungkin increase in terms of knowledge on mental health, but I think in terms of health literacy dia masih tidak cukup, Tan Sri. The mental health literacy still we need to still address the mental health literacy. So Elise, there is this, I'm just looking at the questions there. I'm one of the view that healthcare workers are also among the most affected group of people are suffering emotional disturbances due to several. We need dedicated counsellors for our healthcare team. Okay, Elia, just to let you know, recently Kementerian Kesihatan has actually increased the number of counsellors di Kementerian Kesihatan. We have actually renewed the contract of 200 of our Kementerian Kesihatan to be put at the district. So kalau you pergi every district, kita ada satu counsellor per district, walaupun masa ini masih tidak banyak. Dedicated counsellors or counsellors, what we call as pegawai psychology counselling berdaftar, has actually been incorporated into the team of mental health and psychosocial support dekat district level. So they are looking at cases at the klinik kesihatan. We are looking at cases, and I think one of the most important thing is how do you get this not to say how do you get people to go down to the ground, to the homes, because sekarang ni Ministry of Health, we are working with the as I said, with a bunch of counsellors under the Perkama International, and juga mungkin dengan Kementerian Pembangunan Wanita to actually mobilize. Maybe now we probably cannot mobilize in terms of physical, tetapi mungkin kita boleh mobilize to actually being able to also work with KPKT to look at the urban poor, and maybe we can sort of reach out to them to actually for the people. Untuk healthcare worker, kita ada perkhidmatan mental health and psychosocial support group ataupun support team, one per district at least, and we have actually done a lot of things for the healthcare worker, contohnya in terms of psychological first aid, counselling, referrals dan sebagainya. So we are doing that with the mental health and psychosocial support team at district level. Okay, thank you.
All right. I like to hear from Encik Muhammad Johari. Nasihat Encik Muhammad Johari kepada mereka yang sedang bergelut dengan COVID-19 sekarang ini. Those COVID-19 patients, maybe you have something to say to some motivation for them to stay positive, Encik Johari, before we end our session today.
Is Encik Johari inside? Because I cari-cari ni macam dah tak ada je.
Has he left?
No, he's not in the. I don't see his name anymore here, and his picture.
Okay.
He got cut off, is it? Yeah, I don't know what happened.
And if we don't have him, then probably Prof and Dr. N, you may just want to give some advice to.
Maybe Prof dululah kot. I dah banyak cakap dah ni.
Okay.
Sorry.
Banyak soalan for the Ministry of Health, right?
Yeah, itulah.
But I think I want to comment a bit on the destigmatizations of mental health or COVID. So I think it's a very important step, especially for the workers, because I'm on the ground with patients. For example, they are scared. If, for example, medical certificate, they're scared if I use the stamp with the psychiatrist identifications, because they're afraid the employer will know and so on. So this is a big issue, I would say. We are not really, encourage them to not tell the truth, but the issue is the employer, for example, should allow and understand that mental illness or mental health issue is a common thing. It can happen to anyone, like hypertension, diabetes, and so on. So it should be parity to other illness as well. You cannot see mental illness or mental health issue as a negative thing and give a bad impression and so on. So this is perhaps in the bigger picture. For example, my thought, like insurance, for example, why mental illness? Yeah, they start having some positive step, but perhaps it's not strong enough yet for insurance to cover mental illness as well. So in the bigger picture, perhaps, like in the US, they have a law to recognize that you have to Parity Act, if you're not mistaken. It means you have to treat mental illness like other illness as well. So it will be recognized similarly. So if that's one of the steps, the legal step, I would say. Another step is education, perhaps to involve in HRDF, for example, giving training mental health. So any course, it should have mental health input in that course. It could be about safety, because, for example, someone have accident, perhaps because of fatigue, for example. Fatigue because of stress, burnout, all this. So these all should be also incorporated as well. So when talking about COVID stigma, I think this is very challenging, because I think it's about education. Perhaps people not understand that We have patients, for example, they already in quarantine, they have been treated for COVID-19 and they come back to us. So I'm not feeling anything anyway. So when they are already more than 14 days or 21 days, for example, it is safe. So the issue is give public understanding, because for the moment, because COVID-19 is not permanent disease, it's only infection, like you have flu. So during that period, even flu can cause death, but probably the percentage very small. So compared to COVID, because COVID is so obvious with the risk and so on. So I think education is one thing, put in the training is another thing, to the management. Then probably the ultimate with need political will is a law that recognize mental health, where like, for example, when I was in Malaysian Psychiatric Association, we are already talking about this, but it is very difficult. As much as like the decriminalization of suicide, as Tan Sri mentioned earlier as well. I mean, it takes long process to materialize these changes. So to close my closure on this forum, basically, I think mental health is very important thing that we cannot take for granted. I think the message is more people suffering at the moment. So we need more listener, good listener, willing to listen, boleh mendengar dengan baik kepada mereka yang ada keluhan, ada rintihan, ada kesukaran. Dan I feel that most of the people now not clear-cut depression, but it's more psychosocial, economic related issue now. I think perhaps those who distress, even suicidal ideation, suicidal attempt, all related to that. So need more people to listen, and perhaps as well, of course, 3C, you know, the avoid crowded place,
Close
then avoid
conversation.
confined area, close conversation. Because I'm working in the hospital, thanks God, alhamdulillah, so far I'm safe, but I'm take very strictly precaution and don't never take for granted for anything, even meeting people, meeting patient and so on. So that's my last message.
Okay, thank you, Prof. Looks like we couldn't get
Haji Johari, yeah.
his
Tak
line,
dapat dia.
so he has been connected with us.
Okay.
Okay, I'd like to have Dr. N, you have any?
Maybe dah tutup ke? Tan Sri lah kena tutup ke? Saya second last sikit. Okay, maybe on our part, I think one of the things is I keep emphasizing the concept of actually empowerment and task shifting, because kita sampai bila pun kita takkan, we need to actually bring people forward and actually destigmatize that it's okay to see a psychiatrist. It's okay, you know, to come forward to get help and to get medication for your problem. So this I relate because when Tan Sri said about stigma and destigmatization, especially dekat workplace, because as we said, bila a worker is actually being diagnosed, for example, to have, for example, bipolar, katakanlah bipolar or even schizophrenia, you know, if they actually gets medication and they are on follow up, you know, majikan tu sendiri kena be very supportive in that sense, because we must know that people with maybe correct me if I'm wrong, Pomosim, kalau people with bipolar, there will be ups and downs on the days. Dia samalah, macam ada hari kita sakit, ada hari kita sedih, ada hari kita tiba-tiba terjatuh or something like that, you know.
But kita pun up and down kan.
Saya pun up and down, sama je. But basically, you know, when it comes to the verge, when we need medication, that means we need to see a psychiatrist, you know. Itu the stigma dia. Kalau misalnya katakan dia dah balik, you know, from berjumpa psychiatrist, you know, it's very difficult for them to sometimes own up, you know, to tell, because people will start this oh, you makan ubat, you know, oh, you pergi jumpa psychiatrist, macam tu pun tak boleh ke? And the last part is actually to tell people that if you have depression, you adalah seorang yang lemah, tak cukup iman, tak cukup solat. That is very, very wrong, as what Prof has said just now kan. Jadi I would like to say there was one contohnya kan, kita nak menggalakkan kita punya anggota, especially kita sebagai ketua, tak kira lah di mana level kita, it doesn't matter that you are mungkin you aja 2-3 orang di bawah you, tapi dalam 2-3 orang tu they may have people like suffering from, they have family issues, for example, they probably was just divorced by the husband, mungkin. You know, they go through that issue. They probably are having some depression symptoms. Jadi kita sebagai majikan kena, we need to support in that way, because we need to allow them to get help, to see a proper pakar perubatan, if let's say perlu medication. But even then, bila dah balik dengan medication pun, you need to actually help them to go through. Maksudnya the aspects of counselling jangan dilupakan, the aspects of maybe therapy. And I always say talking therapy is one of the best with a good listener, because sometimes just picking up and calling your good friends who has mental health background jugalah, maksudnya dia cakna kesihatan mental, dia boleh mendengar, you know, masalah kita kadang-kadang. So that is important lah, I think. So I would encourage people to come forward to get help. Do not be afraid ataupun tidak perlu rasa malu kalau ada katakan dalam family kita ada mereka yang makan ubat because of depression, because you need to function. Kita ingat masalah kesihatan mental is when you ada satu masalah yang menyebabkan seseorang itu mengalami gangguan emosi dan juga fikiran hingga menjejaskan dia punya fungsi optima. You know, sometimes dia tidak sampai juga kepada tahap kesihatan mental macam tahap mental illness yang diagnosable macam promosi kata, tetapi you need to get penilaian. So don't, as I said, my last word, janganlah berdiam diri. Let's talk. Okay, alright. Thank you.
Ya, Ilis, izinkan saya memberikan secara ringkas lah sedikit komen mengenai forum pada malam ini lah. Ini yang pertamanya, saya rasa forum pada malam ini sungguh pun ini adalah kali pertama diadakan, tapi saya itu rasalah ia dapat mencapai objektif, dan itu ialah untuk melibatkan para peserta untuk memberi peluang lah ini kepada Dr. Ain dan juga Dr. Musin dan Johari lah untuk berkongsi lah ilmu pengetahuan mereka, pengalaman mereka dengan semualah yang dapat itu menyertai forum ini pada malam ini. Saya sebagai pengurusi Ikatan Komuniti Selamat akan mengambillah cadangan-cadangan yang telah disampaikan oleh Dr. Ain ini tadi, dan salah satunya ialah tentang bagaimana kita dapat memainkan peranan untuk memperkasakan masyarakat ke arah untuk menjadikan mereka lebih memahami, lebih dapat menunjuk empati kepada mereka yang memerlukan pertolongan, bantuan dan itu sebagainya. Jadilah saya rasalah bahawa working group, the working group on mental health that has been set up under Ikatan, I think should continue to have more activities, more programs. And I'm sure where Dr. Ain is able to find the time, I'm sure she will be very happy to join us. But Dr. Musin, I really hope that you can spend more time with us so that we can do more in the future. I agree with you that we need to have more these listeners, and especially at this time when we are facing with a monumental crisis, you know, it is very necessary that our minds, you know, must be open to more knowledge, more understanding, so that we can equip ourselves to deal with the many challenges and to manage whatever stress that we have. But as Dr. Musin has said, I mean, mental health problem is actually, you know, everyone's this a problem. There is none of us who can say, you know, I don't have any stress, I don't have any anxiety or whatever it is, see. But I think as chairman of Ikatan, I also have a fair share of all these problems that we are all facing. But I think whatever it is, I'm happy that we have got a good team. And Ilis, I really hope that you will be able also to play an active part in this working group on kesihatan kesejahteraan. And perhaps I think in the days to come, we should organize more of these sessions, because the public are looking forward to Ikatan to show the way. And I believe that with people like Dr. Ain and Dr. Musin, we should be able to do more. Now, just one final thing I want to mention. I think many of you may not be aware, Dr. Ain talks of talking this therapy, but I think there is there's something even more powerful than that, more effective than that, and that is singing this therapy. And I tell you, you all must listen, have a chance to listen how Dr. Ain sings, And if Dr. Ain sings, I feel I'm so relaxed, I don't have any stress at all. Just listen to her. So anyway, as I said, I just want to just mention this, but I'm sure that there will be an opportunity sometime in the future when we'll be able to listen to a song to be rendered by Dr. Ain. So anyway, that's all I want to say. Elise, I really want to thank you tonight for taking time to moderate this session, and to each and every one of you, I would also like to say thank you. This is the first of many more to come. Thank you very much. Good night.
Thank you, Tan Sri.
Anyway, as I said, I don't know if too long a time I've been given.
Okay, thank you.
Okay.
Thank you very much. Good night.
Yes, everyone, do take it easy during this tough time. I know it's very, very tough, but just remember, IKS will always try our best to be with you because we care for your safety. And with this note, I would like to thank all our speakers and viewers at home for being with us tonight. Hopefully, we will be able to see you again soon, very soon, hopefully. Till then, and good night, everyone.
Okay. Alright.
Thank you, Dr. Ain.
Yes, thank you.
Sama nanti Tan Sri saya nyanyi kat Tan Sri.